Good afternoon. I'm Alan Unell, and this series of videos is called Healthcare Advocacy, where we address problems in the healthcare system and then try to take action to make a better system for all of us. Let me point out that down below in the YouTube description box is a hyperlink to the Healthcare Advocacy newsletter that is the text for today's talk. All of the references and studies and data that I talk about are actually linked there. You can actually go and subscribe to that newsletter and get it put in your inbox every day for free. Let's get started. Let's talk about what health insurance looks like in the United States. We are the only industrialized nation without a healthcare system that makes sure that all residents can go to a doctor without going bankrupt. Let's see who has what kind of coverage. I will point out that the data I'm using comes from the United States Census and is from 2024. 27 million Americans have no health insurance at all. Employment-based insurance covers about 181.3 million of us for some or all of the calendar year. People kind of go in and out. I would point out that the cost of insuring a family is about $27,000 a year, and it rises yearly, as do copays and deductibles. These plans have prior authorizations that delay or deny care, and they have in-house networks so that it's difficult to choose your doctor freely without extensive or extreme extra cost. Medicare and Medicare's commercial counterpart, Medicare Part C, which I call Medicare Disadvantage, covers 64.36 million Americans. It's about 10% of the population. Prior authorizations cause delay or denial of coverage for about half of them because those Medicare Disadvantage programs are commercial and they look just like regular commercial insurance. They also limit the doctors you can use to their in-network plans. 59.44 million of us have Medicaid. As a reference, Medicaid is different in each state. It is a federal-state partnership. They both pay for it, but it's a different plan in every state. The medicines and procedures covered can vary wildly between states, and state legislators, not doctors, decide what they want to insure. This can be a danger if your illness is on the bad list. In particular, we've seen states that have denied care to lupus patients, and essentially it's a death sentence. Many of those patients die. The Childhood Health Insurance Program, CHIP, is a subset of Medicaid for children. I want to point out that 21.4% of all children in the United States have CHIP for their health insurance. So just wake up, America, because that says we have a real poverty issue in the United States. Direct purchase plans like the Affordable Care Act cover 36.05 million people. We've heard that without low-income tax breaks for many, the cost will double in 2026. Those plans come in 3 different flavors: gold, silver, and bronze, depending on how much you want to pay and what the deductibles will be. Bronze is the highest deductible, most affordable kind of plan. In middle America, say Indiana, a family of 4 making a mean income of about $119,000 would pay about $1,400 a month for a bronze plan, and their deductible would be $20,000. No benefits until you cough up $20,000. I know that people are foregoing insurance in my neighborhood because they figure they're not going to get sick enough to have to cough up $20,000. Good luck. Anyway, 13.3 million people, between 3.5% and 4% of the population, get their insurance through the VA or TRICARE or CHAMP VA. Those are programs that are designed for veterans and military dependents. So those are the systems we have in place. We have some HMOs, some network-based systems, some government-owned networks, some with a public insurance trust, and 27 million, remember, who can't afford insurance at all. What do Americans think about it? Well, the Kaiser Family Foundation executed a poll recently asking Americans just that. They found that just under half of U.S. adults say it's difficult to afford healthcare costs. About 3 in 10 say that they or a family member in their household had problems paying for health care in the past year. Hispanic adults, young adults, and the uninsured are particularly likely to report problems affording health care. The cost of health care can lead some to put off needed care. About a third of adults say that in the past year, they have skipped or postponed getting health care that they needed because of the cost. Notably, 3 in 4, about 75%, uninsured adults under age 65 said they went without needed care just because of the cost. The cost of prescription drugs prevents some people from filling prescriptions. About 21% of adults, 1 in 5, say that they have not filled a prescription because of the cost, while a similar share, 23%, say that they have instead opted for an over-the-counter alternative. About 1 in 7 adults say that they have cut pills in half or skipped doses of medication in the last year because of the cost. That can be incredibly dangerous. A third of all adults say that they have taken at least one of these cost-saving measures in the last year, including larger shares of women and those with lower incomes. Healthcare debt is also a burden for a large share of Americans. In 2022, 4 in 10 adults, 41%, reported having medical debt or dental bills that were a debt, that is, they were not paid, and this is money owed to credit cards, collection agencies, family and friends, banks, and other lenders that they had to go to cover these costs. A disproportionate share of that debt rested on Black and Hispanic adults, women, and parents, those with low incomes, and of course uninsured adults, who indicate they also have health care debt. Now, those who are covered by health insurance are not immune to the burden of health care costs. About 4 in 10 insured adults under 65 worry about affording their monthly health insurance premium, and large shares of adults with employer-sponsored plans and those with marketplace coverage rate their insurance as only fair or poor when it comes to their monthly premium and to out-of-pocket costs to see a doctor. Notable shares of adults also say that they are worried about affording medical costs, such as the cost of healthcare services, including out-of-pocket costs not covered by insurance, such as copays and deductibles, or unexpected bills. About 6 in 10 adults say that they are either very or somewhat worried about being able to afford the cost of healthcare services, 62%, or unexpected medical bills, 61%, for themselves or their families. So let's review. 40% have healthcare debt that they are having trouble paying. 60% are worried they can't afford their premiums, copays, and deductibles. 21% are not getting their prescriptions filled that the doctor ordered because they can't afford it. So what do you do? The data above that I've given you are from 2024. We are in 2025, and I've got to tell you, it is actually worse today, by far, due to the president's one big bogus bill, because he's cutting people from Medicaid, and he is making things way more expensive for people on the ACA. They're going to drop off. So millions more people will not have insurance. This year, we spent a lot of time in Congress removing people from Medicaid and making those ACA plans far more expensive. And we're making sure that people choose to not have insurance. That's really what's going on, because they can't afford it. It's a choice that Republicans have made. They want to push people off of insurance. The problem overall is that health care in the United States is way too expensive. Why is that? Well, it's too expensive because we have outsourced the payment system for health care to private companies. It's important to them to make money on the transfer of those funds. Health insurance used to be, I know it's hard to believe, but it used to be a non-profit business in the United States, but no more. It is now an extremely profitable venture. According to the Nonpartisan Congressional Budget Office in 2022, we waste 20% of healthcare costs on unnecessary overhead. That includes prior authorizations, claims denials, negotiating those denials, marketing, and profit. In 2020, they estimated that if we, as a country, implemented any public trust health insurance plan for all Americans, we would save $400 billion on overhead and $200 billion on prescriptions. Accounting for inflation, that's $700 billion in 2025 dollars. Universal health care costs less, everyone is covered, and no more medical bankruptcy. It answers an awful lot of questions. P.S. If you happen to be pro-business, this is for you because insurance costs will plummet and will make companies way more competitive. You'll have a lot more cash in your pocket. Moreover, according to a recent Gallup poll, 62% of Americans want the government to make sure that everybody has health insurance. Look, let's take an action. Since everyone is finally talking about health care, let's take a moment to let our senators and congressperson and the president know that we have a health care problem and that they can fix it. I'll put a link in the description box so you can find your representative, or you can just text SIGN, S-I-G-N, P-Z-N-I-L-G, all caps, P-Z-N-I-L-G to 50409. That's ResistBot. And they will send this message to those representatives and the president. I want you to know that 27 million of us can't afford health insurance. 40% of us have health care debt, and 60% of us are worried we can't afford our health insurance premiums, copays, and deductibles. And 21% of us are not getting prescriptions our doctor ordered because we can't afford it. Moreover, 62% of Americans want the U.S. government to make sure that we all have health insurance. The vastly improved Medicare for All of Us Act, H.R. 3069, covers all of us, saves the United States $700 billion every year in wasted overhead and excess prescription costs. Do yourself and your constituents a favor. Make sure they can all go to the doctor when they need to and not go broke. I want you to see that H.R. 3069 passes and protects all Americans. Thanks so much. That's what I've got for you today. Down below, you can leave me a comment or send a comment to healthcareadvocacy1@gmail.com. It can be a comment or a topic you'd like covered in this series. Thanks so much. Happy New Year.